Hello and welcome down to Fox Avenue. Today we are in conversation with Mr. Ashik, who happens to be the COO of oDoc. Welcome down.
Thank you very much for having me.
So I am JJ and this is Tash.
Hi guys.
We'll be asking you a few questions just to, so that people could know what oDoc is all about.
Of course.
Yes. So first of all, how are you doing today?
Very well, thank you.
Okay, that's amazing. Please let us know, and of course everyone watching, about what oDoc really is.
So oDoc is a mobile app where you can video call, audio call, or chat with a doctor. We have over 700 doctors and healthcare professionals on board. And the best part is that a doctor will call you within 3 minutes on the oDoc app. And you can consult them from anywhere.
I would say that's actually quite convenient considering the pandemic as well.
Yeah.
And everyone, trying to stay safe. So that's actually a very good service to have.
Thanks, yeah.
So secondly, we know that you give a lot of options on the app as well. We would like to know, is it only telemedicine consultation that oDoc facilitates, or are there any other services available on the platform?
Yeah, so oDoc is mainly a telemedicine application. But what you can also do on oDoc is you can order your medicines home. So we will deliver your medicines to your home. And you can also order mobile lab service to come and collect for any investigations that the doctor may have prescribed.
So you're talking about like blood samples?
Blood
things
samples, yeah, even if it's a PCR test, we have a mobile PCR testing service. So all of that, they can come and then they can do it at home itself. And further, you don't have to stay in a queue. So this is so much easier, especially in today's pandemic-driven world. And also, if you have to go for a physical appointment, you can book that through the oDoc app as well.
Lovely.
So Ashik, with regards to obtaining the services from oDoc, of course, how is it done and how are payments done in that regard as well?
So the easiest way to get access to our app is just to download and register. You can download the app from the Google Play Store or the Apple App Store. It's that easy. With regards to payments, you can pay as you go, which means that you will pay per consultation that you do. You can also buy a subscription, monthly or yearly, and you're entitled to unlimited consultations that are available in those specific packages. oDoc is also available through certain offices.
Okay.
So corporates can buy it on behalf of their employees, and therefore they will get it free through their employees. And the employee pays a fixed fee to oDoc.
Okay, and supposing, a doctor is asking you to possibly ask to meet them personally, if ever a situation or a scenario comes like that, will that be possible rather?
Yeah, of course. So we understand that all consultations can't happen through oDoc. For the certain ones that are required for you to come in physically, the doctor will ask you to come in physically and they will not charge you for the oDoc consultation. So they have the option to not charge through the oDoc app.
So it doesn't really matter where the doctor is, they'll just call you to wherever their hospital or, the consultation.
Yeah, so generally doctors see at a few different locations. So they will tell you to come and then you can pick a location and go. So that's the only dependency there.
Oh, that's wonderful.
So in what ways can oDoc be of help to people, like services?
So we've heard many stories of mums and dads not needing to rush their crying babies to the hospital because they can now speak to a pediatrician through an app on their phone. That is definitely one of the bigger use cases. But one that we are also intrinsically proud of is the one where a lot of people have told us that they've been able to speak to mental health professionals because now they get to bypass the stigma that is attached to it. So that is something, we are really happy to facilitate at least. And then another one is obviously with the pandemic, people don't want to go into hospitals, crowded waiting rooms. So they speak to the doctors a lot more. And then people who want to save an hour or two in their day, it might be you, it might be anyone. They can now just speak to the doctor while they're going to office, while they're coming in, at office, at home, for their elderly parents that they again don't want to take to the doctors. So those are the main use cases. So mainly I would say it's to save time, money, and then with mental health privacy as well.
True, that's quite convenient.
So Ashik, what really motivates you to do what you do, and of course, what motivates you and your team?
Yeah, so I think the main thing that motivates our team is actually our aim with the company, which is to make healthcare more accessible, affordable, and personal. We want to make oDoc a one-stop shop for all your medical needs.
Yeah, and of course, now with the pandemic and all that, it's so much easier now to have an app like this.
Yeah, for sure. So I think there was quite a bit of difficulty in getting people to buy into the app before the pandemic, but during the pandemic we've seen a huge number of people use it purely because it's safer, it's more convenient, it's easier, and it's the same care that you get through the app.
Right.
So with the pandemic we've seen our numbers grow, and what we've seen is even after after August and September, where it kind of died down a bit, our numbers kept growing up to now.
Oh, that's amazing.
Yeah.
And how has your journey been so far?
The journey's been tough, it's been interesting, it's been a lot of fun, to be honest. I think everyone we work with, especially at oDoc, we have a lot of fun. It's a really young crowd. So yeah, we work hard, we play hard, and we try to give the best to our customers.
So last but not least, we'd also like to know what are the future plans like for oDoc? Well, you're all excited for something new and big that's going to be changing on the app, or?
So the app, we're actually in the midst of rewriting our entire app. So it's going to be a lot better in the near future. What we can say is at the moment we are a one-stop shop for all your medical needs. In the future we want to get this one-stop shop into everyone in the island. We want everyone in the island to have accessibility to oDoc and to the great care that is available. We also want to take this oDoc concept regionally. We are already in the Maldives, so we want to go regional elsewhere as well. So yeah, that's basically our plans for the future.
For the future. Okay, so thank you for joining us.
Thank you very much for having me.
And thank you for educating people on oDoc as well. I think you guys are doing a great job with regards to the pandemic, and I hope it grows after the pandemic as well. And to everybody out there who's listening, of course, make sure you download the app. Of course, it's called oDoc, and it's very, very helpful concerning your parents or babies or even your own medical needs, of course. Stay tuned for another episode of Fox Avenue. Thank you.